Question number 1. Describe hip joint. The hip joint is the junction where the hip join the leg to the trunk of the body. It is comprised of two bones, thigh bone or femur and pelvis, which is made up of three bones, is called as ilium, ischium and pubis. The ball of the hip joint is made by the femoral head, while the socket formed by the acetabulum. Classification of hip joint. The hip joint is the ball and socket type of synovial joint that connects the pelvic girdle to the lower limb. In this joint, the head of the femur articulates ಅಂತಂದ್ರೆ ಜಾಯಿಂಟ್ ಆಗೋದಕ್ಕೆ ಆರ್ಟಿಕ್ಯುಲೇಟ್ಸ್ ಅಂತಾರೆ ವಿತ್ ದ ಆಸಿಟಬಿಲಮ್. ಆಸಿಟಬಿಲಮ್ ಅಂತಂದ್ರೆ ಈಗ ತೆಗ್ ಟೈಪ್, ರೌಂಡ್ ತೆಗ್ ಟೈಪ್ ಇದ್ದಂಗೆ ಇರ್ತೈತಿ ಬೋನ್ಸ್, ಅದರೊಳಗೆ ಅದಕ್ಕೇನು ಹೇಳ್ತೇವೆ ನಾವು ಆಸಿಟಬಿಲಮ್ ಅಂತೇವೆ. ಆಫ್ ದ ಪೆಲ್ವಿಸ್. ಇಲ್ಲಿ ಡೈಗ್ರಾಮ್ ಒಳಗೂ ನಿಮಗೆ ಗೊತ್ತಾಗ್ತೈತಿ ಆಸಿಟಬಿಲಮ್ ಅಂತಂದ್ರೆ ಯಾವುದು ಅನ್ನೋದು. ನೀವು ಅದನ್ನು ನೋಡಿ ತಿಳ್ಕೊಬೇಕು. ವಾಟ್ ಆರ್ ದ 8 ಫಂಕ್ಷನ್ಸ್ ಆಫ್ ಬೋನ್? The major functions of the bones are body support, facilitation of movement ಅಂತಂದ್ರೆ ಮೂಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ, ಎಲ್ಲ ಟೈಪು ಮೂಮೆಂಟ್ ಮಾಡಲಿಕ್ಕೆ ಹೆಲ್ಪ್ ಮಾಡ್ತೈತಿ. ಪ್ರೊಟೆಕ್ಷನ್ ಆಫ್ ಇಂಟರ್ನಲ್ ಆರ್ಗನ್ಸ್, ಸ್ಟೋರೇಜ್ ಆಫ್ ಮಿನರಲ್ಸ್ ಆ್ಯಂಡ್ ಫ್ಯಾಟ್ ಆ್ಯಂಡ್ ಹೆಮಟೋಪಯೋಸಿಸ್. ಟುಗೆದರ್ ದ ಮಸ್ಕ್ಯುಲರ್ ಸಿಸ್ಟಮ್ ಆ್ಯಂಡ್ skeletal system are also known as musculoskeletal system. Here diagram is there. You have to draw the diagram and label it properly. Question number 2. Cubital fossa. The cubital fossa is the small triangular area located on the anterior surface of the elbow with the apex of the triangular point distally. It contains some important structure on their passage from the arm to forearm. Number 1, it is homologous to the palpebral fossa of the lower limb. Functions of cubital fossa in anatomy. It supplies the majority of flexor muscles in the forearm. It runs distally in the arm on the lateral side of the brachial artery until it reaches the middle of the arm, where it across to the middle side and contact the brachials. Here diagram is. Question number 3. Name the parts of respiratory system and describe the larynx. 11 parts of the respiratory system. These are the parts: nose, mouth, throat, pharynx means voice box, larynx means windpipe, trachea means large airway, bronchi means small airway, and bronchioles and also as well as lungs. These are the parts of respiratory system. Again, muscles of the larynx. Extrinsic muscles which produce the movement of the hyoid bone. These are the infrahyoid. Infrahyoid means again 4 muscles is also including sternohyoid, mammohyoid, sternothyroid, thyrohyoid. Okay, these are the 4 muscles are there. Again, the suprahyoid muscles. Suprahyoid muscles means stylohyoid, then digestic and mylohyoid and genihyoid. Okay, these are the suprahyoid muscles, intrinsic muscles, which move the vocal cords in order to produce the speech sound. There are three parts of the larynx. The larynx is often divided into three sections: sublarynx, larynx, and supralarynx. It is formed by the nine cartilages that are connected to each other by muscles and ligaments. The larynx plays an important role in human speech. Question number 4. Describe the epithelial tissue with example. The epithelium is the type of body tissue that forms the covering on all internal and external surface of our body. Lines, bodies, cavities, and hollow organs, and is the major tissue in glands. The four major classes of simple epithelium are: one is the simple squamous, second one is the simple cubital, third one is the simple columnar, fourth one is pseudostratified muscles. The main functions of the epithelial tissue. There are three primary functions of epithelial tissue: serving as a protective barrier, secreting substances, and absorbing substances. Example, here diagram is also there. Then you have to draw the diagram of all type of muscles and examples using disposable needles and practicing safe sex, that is used to protect the link condoms. Question number 5. Describe the continents of intracostal space. The intracostal space is the anatomic space between two ribs. Since there are 12 ribs on each side, there are 11 intracostal spaces, each numbered for the rib superior to it. Number 1. The intracostal space continents the external intracostal, the internal intercostal, and the innermost intercostal muscles arranged in three layers: the neurovascular bundle consisting of the intracostal nerves and vessels, lines in between the internal and the innermost intercostal muscles comprise many different group of muscles that run between the ribs and help from the move the chest wall. The intercostal muscles are mainly involved in the mechanical aspects of breathing by helping expand and shrink the size of the chest. Here intercostal space diagram is also there. You have to draw the diagram. Question number 6. Name the muscles of the hand. 4 muscle group comprise the intrinsic hand. These are the thinner, hypothinner, and introseous, and is the lubrical muscles. There are over 30 muscles in the hand working together in a highly complex way. movement of the hand are mostly started by the muscles in the forearm. Muscles of the hand. Percussion movements means small motor units. Thinner muscles means ABD, P brevis, flex P brevis and opponents. Hypothinner muscles. Question number 7. Name the veins of the upper limb. Here diagram is there. There are usually in the upper limb there are some major veins that passes a specific path. These veins consist of basilica, cephalic and median cubital vein as the major superficial veins. Basilica and cephalic veins began their path from around the wrist and continue towards the upper region of the forearm. Question number 8. Name the endocrine glands. Endocrine glands are ductless glands of the endocrine system that secrete their products, hormones directly into the blood. The major glands of the endocrine system include the pineal gland, pituitary gland, pancreas, ovaries, testis, thyroid gland, parathyroid gland, hypothalamus gland, adrenal gland, female ovaries, male testis, and pituitary, thyroid, and adrenal gland, which is a diagram is also there. You have to see the diagram and draw it and label it. Question number 9. Classify the connective tissue. Connective tissues are classified in 3 main: loose connective tissue, dense connective tissue, and specialized connective tissues. Loose connective tissues: alveolar tissues, adipose tissue, reticular tissue. Dense tissue means dense regular, dense irregular, and elastic tissue. Specialized connective tissue means cartilage, bone, and blood. These primary functions of connective tissue including transportation of nutrients and metabolites through direct diffusion between the organs and connective tissue proper. Immunological defense means they will fight invading cells, while inflammation means when they will fight the inflammation is occurs means ಯಾವಾಗಾದರೂ ನಮಗೆ ಗುಳ್ಳಿ ಅದು ಎದ್ದಾಗ ಅದರ ಜೊತೆ ಏನು ಮಾಡ್ತಾವೆ, they will fight against them. And structural support is also there from connective tissue, and they will repair also at the time of injury. Question number 10. Name the parts of the male urethra. The male urethra can subdivide into 4 parts, each parts containing unique gross and histological features. Pre-prostatic urethra, location, extension inferiorly from urinary bladder, and ends prior to the entering the prostate gland. Prostatic urethra membranes. Urethra is spongy. The posterior urethra means that is the proximal urethra, near to bladder. This is 4 centimeter in length. It lies in the pelvic. It has 3 parts. Those are the pre-prostatic part and below bladder and prostate. Then B, prostatic parts means within the prostate. C means membranous part through the perineal membrane. Here diagram is also there. You have to draw the diagram. Question number 11. Name the parts of uterine tube. A uterine tube contains three parts. The first segment closest to the uterus is called as isthmus. The second segment is the ampulla, which becomes more dilated in diameter and is the most common site for fertilization. The final segment, located furthest from the uterus, is the infundulum. Here diagram is also there. You have to draw the diagram and label it. Fallopian tube, uterus, uterine artery, ovary, ovarian artery, then ovarian branch of uterine artery. Question number 12. Name the continents of palpebral fossa. Continents of palpebral fossa: contestable nerve, common fibular nerve, also known as the common perineal nerve. Palpebral vein, palpebral artery, a continuation of femoral artery. Small spinous vein means that is termination. Okay, then palpebral lymph nodes and vessels continents. The major continents of the palpebral fossa from superficial to deep include nerves, veins and an artery. Tibula and common fibular means common perineal branches of the sciatic nerve. These are the most superficial structure. They enter the fossa beneath the biceps femoris muscles. And also here there is a diagram, the palpebral fossa boundaries and continent. Question number 13. Name meninges covering the brain. Meninges refer to the membranous coverings of the brain and spinal cord. There are three layers of meninges known as the dura mater, arachnoid mater and pie mater. These coverings have two major functions: provide a supportive framework for the cerebral and cranial and acting with vasculature, acting with cerebrospinal fluid to protect the CNS from mechanical damage. The meninges are often involved cerebral pathology as a common site of infection. Those are meninges, which are the three layers, and intracranial bleeding. In the article we shall look at the anatomy of the three layers and their clinical correlation. Question number 14. Name the parts of the compound microscope. Compound microscope is an upright microscope that uses two sets of lengths to obtain higher magnification than a stereo microscope. A compound microscope provides a two-dimensional image, while a stereo microscope provides the three-dimensional image. Then here microscope diagram is also there. You have to draw the diagram. And question number 15. Name the muscles of the leg. Main leg muscles: quadriceps, hamstrings, adductors, shins, and claves. Posterior: the muscles in the posterior means back of our lower leg are calf muscles, which include the gastrocnemius and the serratus, flexor digitorum longus, flexor hallucis longus, palpitus, which sides deeper in our leg just behind our knee joints, means tibialis posterior.